Before I begin, I'm going to check any markers or isolation precautions or fall precautions on the door. There appears to be none. And as I enter the room, I'm going to perform my hand hygiene, and I'm going to assess any environmental hazards. There appears to be none. Okay, my name is Tempura. Hi.
Oh.
Okay. I'm your student nurse today. I'm gonna taking care of you. And then can I assess your bedside assessment this morning?
Yes.
Okay, thank you. Can I get your name and date of birth, please?
My name is Jenny Smith, and my date of birth is May 3rd, 1994.
Okay, thank you so much, Mrs. Smith. Okay. Can I rate your pain? 0 is none, 10 is the worst.
0.
Okay, thank you. If she has pain, I'm going to assess her pain with mnemonic old cards. And then I'm going to check her vital signs, which is blood pressure, temperature, pulse, respiratory rate, and then O2 in terms of her facial expression is appropriate to the situation. And then also her body position is relaxed and comfortable as well. And then she is able to make her hair, makeup, and shaving. And then next, I'm going to move to the neurology and then mental status. First, can I get your name again?
Jenny Smith,
Okay. Do you know where you are?
John Tyler Hospital,
Okay. So what month it is?
April.
Thank you. She is alert and oriented by 3, time, place, and person. And then I'm going to check her pupil size and reaction. Can you focus on me? Follow the way. Okay, thank you. Her pupil size is 3 millimeter each. React to the light around and accommodation, which is PROA. And then also her eye contact is spontaneously to the name, and then her speech is clear and articulate, realistic, and then appropriate. And then also I'm going to check her sensation. Can you close your eyes, please? Do you know which side?
Right hand,
Okay. Which side?
left hand,
Which?
right foot,
Okay. Which?
left foot.
Okay, thank you. She has sensation in her upper and lower extremities equal bilaterally. And then also I'm going to check her swallow. Can you swallow me, please? Okay, so she can swallow. And then also, can you give me a big smile, please? Okay, thank you. So she does not have any ptosis or a facial droop. And then I'm going to move to the respiratory system. First, I'm going to assess her respiratory rate, which is 16, and then effortless and unlabored. Then I'm going to listen to her breath sounds. Anterior and posteriorly. Her breath sounds clear, and then can you do this? Okay. She does not have any cyanosis or do this one. Okay, no clubbing. Can you cough for me, please? Okay. She does not have any cough. If she has cough, I'm gonna ask about if that cough is productive. If that is productive, I'm going to assess color and amount. And then, can you deep breath for me, please?
Oh, deep breathe.
Yeah. Okay, so she can deep breathe. Okay. Later, I'm going to check her cardiovascular system. I'm going to listen to her apex. 1 full minute. Okay. Her heart 84 and the regular, and then I could hear S1, S2, and then also there is no murmur or no rubs. And then I'm going to listen to her heart sounds diaphragm and then repeat with bell. First, aortic, pulmonic, Argus point, and then the tricuspid and mitral. Okay. And then her heart sound is all regular and then normal sinus rhythm. And then also I'm going to check her. And I put here. I'm going to check her apical and then radial pulse simultaneously. There is no pulse deficit. And then also I'm going to check her radial pulse strength simultaneously. They're both equal +2 strength bilaterally. And then I'm going to check her pretibial edema. There is no edema, which is 0. And then I'm going to check her posterior tibial pulse, okay, which is 2+ equal bilaterally. And then also I'm going to check her dorsalis pedis pulse, which is +2 equal bilaterally. I'm going to check capillary review, both upper and lower extremities, which is under 2 seconds. And then her skin is warm to touch, both upper and lower extremities. And then also I'm going to check her skin, and then her skin is even skin tone within her racial heritages. And then I'm going to, her skin is warm to touch, and then dry, and then brisk to the toucher. And then also I'm going to check any skin breakdown, posterior and anterior, and there is no skin breakdown. If any skin breakdown, I'm going to use redness scale for assessment. And then I'm going to check any skin lesions. Next, I'm going to move to the musculoskeletal system. First, I'm going to check any symmetry of her head, eye, face, thorax, the arms and legs, hands and feet, and hips. There is no deformities. And then also I'm going to check her muscle strength. Can you give me opposite? Grab me.
Okay, there you go.
Okay. Opposite? Go. Okay. Okay. Here. Okay. All right, thank you. So she has muscle strength 5/5, upper and lower, both bilaterally equal strength, full strength to opposition. And then also I'm going to check her range of motion. Can you do this for me? Okay. And then can you pull your legs up to the, okay. Thank you so much. All right. She has full range of motion. There is no impairness of her arms and legs. And then I'm going to then also I'm going to check her abdomen. For this one, I'm going to flat her the bed to see her contour, okay, which is flat. And then okay, she is her nutrition is within healthy range. And then also I'm going to auscultate her bowel sound, all 4 quadrants, from lower right to upper right, upper left, and then lower left. And then I could hear all active bowel sounds all 4 quadrants. And then also I can palpate, light palpation, to see if there is any tenderness. Do you have any tenderness? Okay, thank you. She doesn't have any tenderness. Okay, Miss Smith, did you have a bowel movement today?
Yes.
Okay, thank you. She has bowel movement and passing gas also? Okay. And then I'm going to ask her about if she tolerate current diet. You well tolerate
Yes.
diet? Okay. Thank you. And then I'm going to move to the activity. No, I'm going to check her genitourinary first. So, do you voice regularly, Miss
Yes.
Smith? Okay. She said she was regularly, but if not, I mean, I'm going to check check her bladder distension for that. And then also I'm going to check her urine color and clarity and amount and order. And then I'm going to move to the activity. If she is on the bed rest, I'm going to turn her every 2 hours. And then also I'm going to check, I'm going to move to her chair if indicated. And then also I'm going to check any assistance needed or movement to tolerance to movement. And then also I'm going to check any assistant ambulatory rate aids or the equipment needed if indicated. And then also for the equipment, I'm going to check first oxygen appliance setting and then placement, and then check the IV. Also, I'm going to check IV fluids rate on the pump or the insertion site for the intactness, redness, or the swelling. Okay. And then also I'm going to check catheter for secure device, and then also check for the kinks in the tube, and then the catheter bags sighting secure, and then check for drainage tubing and site, and then check for the dressings, the intactness, and then also check SEDs or CEDs and foot pumps. And then next, in the clothing, I'm going to check to return to her bed to the lowest position. Okay, and then also I'm going to ensure the brakes locked, and then make sure the appropriate side rails are up, and then cold bells are reached, and then if make sure the bed alarm if needed, and then document assessment findings.